I'm Dennis Spencer. I'm the CEO for Medical Network of Alaska and Capstone Clinics.
Matt Jones, Director of Non-Clinical Operations for Capstone Clinic.
I'm Wade Erickson, family physician, founder of Capstone Clinics.
Capstone Clinics is a family medicine clinic primarily. Been in business for about 17 years, 18 years. And during the pandemic, we started doing a lot of COVID response, COVID testing, immunizations, things of that nature.
We were used to doing testing for a variety of viruses and illnesses through our urgent care and family medicine clinic. But the sheer scope of this and the way that it affected us early on required that in order for us to maintain safety for our staff and for our patients, that we changed the model in which we evaluated people who had COVID-type symptoms.
Early on in the pandemic, we made a decision to keep our clinic open for patients. We didn't want to have to close our clinic. In order to do that, we realized rather quickly that we were going to have to provide some form of testing and screening before people came into our clinic for care. To that end, we set up a small box in front of our clinic. It was unsightly, but it served the purpose. And so we started doing testing out of that small box. From there, everything just expanded rapidly.
When people ask, what did you do for COVID? I tell them I did COVID testing and vaccinations for the entire state of Alaska. Everywhere from Ketchikan to Dead Horse and Dillingham to Anchorage, all the major airports, testing and screening. We have vaccination locations in all the airports.
We found ourselves relatively good at doing the COVID testing, and that was recognized by various organizations, and they said, hey, we need you to go to Dillingham. Hey, we need you to go to Juneau. Hey, can you go to Ketchikan?
We realized that if we really wanted to control this, we had to bring it in-house. So that's when we bought the equipment to do the testing in-house. And right now our test, a TMA lab-based test, we can get you the results back in 36 hours. So we're pretty proud of that, but that was probably one of the major hurdles we had to overcome.
We made a decision early on that whenever the money started to get more scarce at the federal level and governmental level, that we would just keep on doing it. And so we made the decision to keep on helping people in the community.
A lot of people were very thankful, and they showed their appreciation, and they told us thanks for being here. Not everybody was so kind. And so for my staff and the community of Alaska that helped us get through this pandemic, we owe you everything.
And it was real exciting to see a public-private partnership work so well. I think that we did it as well as anybody in the world, and that's a source of pride for us, and really made us feel like a valuable member of the community, which is gratifying.